Good morning. Nice to see everyone. I'm Dr. Sara Cody, County Health Officer. And I learned yesterday that the Centers for Disease Control had issued revised guidance on their testing, recommendations for testing. Since then, we've had a number of inquiries. So I wanted to come before you today and clarify our county guidelines and our county order regarding testing. Before I do so, I want to say that when I first heard about this change in guidelines, I actually didn't believe it, for it seemed entirely bizarre, in that it undercuts our very basic tenets of how we control an infectious disease. Testing and having individuals know their status is foundational to our ability to control an infectious disease, and certainly our ability to control COVID. So let me start with the new guidance and highlight where our local guidance and in fact our local order is different. The revised guidance says that someone who has mild symptoms may wish to get a test, and a test may be offered. Our local guidance and our order is quite clear that anyone with any symptoms of COVID should be tested right away. This will be particularly important this winter as more respiratory viruses come and circulate. It's very important to know whether your symptoms are because of COVID or something else. Number two, the new CDC guidance says that if you've been in close contact with a confirmed case of COVID, you do not necessarily need a test. This was the part of the guidance that felt, frankly, most bizarre. The truth is that if you've been in contact with someone who is infectious with COVID, you absolutely need to get a test. And in fact, our health officer order requires our healthcare facilities to test contacts. I want to say before I hand this over to Dr. Fenstershieb that testing is our way out of this epidemic. Since the very beginning, testing has been the Achilles heel for our country and for our county in getting us out. When you get a test, you know your status, you know whether you're infectious, and you need that information for two reasons. One, for yourself, to know whether you're going to get more ill and to be able to watch your symptoms. Number two, you need to know whether you pose a risk to your family and your friends and your coworkers so that you can tell them whether they need to be tested. If everyone knows their status, whether they're infectious or not, they can take action. If you're infectious, you isolate. If you're a contact, you quarantine away from others. And that is the way we are going to get ourselves out of this pandemic and return to our lives. That is how we are going to be able to open businesses, open activities, and most importantly, that is how we are going to get our children back in the classroom where they can best learn. It's through testing. It's through knowing your status. It's absolutely foundational. And so here in our county, in the county of Santa Clara, we are going to continue to work with all of our healthcare partners to ensure that they offer testing to the groups that need it. And we, through our county health system, are going to continue to offer mass testing at several sites as often and as robustly as we can for as long as it takes. Thank you.
Thank you, Dr. Cody. Again, Dr. Marty Fenstershieb and I have been leading up the testing task force, and we have really done, I think, a tremendous job with our team, with the help of those around the county, in increasing the capacity of testing in our county. We have gone from doing 1,000 tests a day to now upwards of 6,000 to 8,000 tests a day. It's very critical to realize that 35 to 40% of people who are infected may be totally asymptomatic, meaning without any symptoms, and so you wouldn't know that they were infected. If we don't test those people who are most likely contacts to someone else who was infected, if we don't test them, we will not know that they were infected. If we don't know that they're infected, they will then infect others, their family, their friends, their coworkers. And that is critical. Testing is very, very important, especially to the contacts. We need to follow the science, and that's the science. And everyone agrees that has a science background, that testing is critical. I respect the CDC, have always done that through my career. However, I believe that these changes in the testing guidance have not come from the CDC directly. I believe that these changes in the guidance have come from further up the chain in the federal government through the Health and Human Services Department or from the White House, and they are misdirected. They are totally misdirected. Failing to test is not going to end this pandemic. Failing to test will not make the virus go away. Lacking a strong testing program, I think nationally, has been one of the largest failures of our federal government. However, we will not change our guidance because of this. We will continue to have a strong basis in science. We will continue to encourage people to be tested so that we can contain this pandemic. And so I urge people, again, if you are asymptomatic, get tested. If you are a contact to anyone, get tested. And if you are a frontline worker, get tested. We have plenty of testing sites on our website. The fairgrounds has recently been open. We have the capacity of testing over 1,000 people there a day. So people, please take advantage of the testing in this community. Thank you.